This is an infinity brush, and this has got a very special design where we have two types of brush. One is the stiff brush, which can cause defect in that stricture, and then there are soft bristles which will collect these abraded cells. And then there is a gap also. We'll show you how it looks like once we take this brush.
Now the fluoro in situ hybridization has increased the sensitivity of the brushing, as mentioned here, from 26 to 66% by Kushner et al.
We'll take this brush first, then we'll discuss about that. You can see the brush has come down up there, and there is a radiopaque marker which shows the tip of the catheter, and then there is a nitinol wire and the brush on that top of it, and there is a very good pushability. Can you do the brushing? And you can see how he's taking the brush. So he's doing to and fro motions, at least 5 we do from that stricture side, and we'll show you the design of this brush. So there are the stiff brush are cutting through the tissue, and then there are the soft bristles which catches these the detached cells. Can we have a brush outside also?
Yeah, I think Asma, the question that you asked is that because we are doing rose-like now, our pathologist, Dr. Anuradha, is waiting here for the specimen, and she'll tell us immediately. So that's the reason why we can increase our yield by this rose technique to almost 80%. Otherwise, if we do conventional, as you said rightly, it's only 60%. We can also use a more costly technique of 𝘃𝗶𝗱𝗲𝗆, which we found to be useful. And this is a paper that Mohan published in GIE. But I think...
well, I know that for the biliary, we usually combine the FNA with biopsy. And for pancreatics, we go with FNA. It can be enough. But for biliary lesion, we usually combine.
Yes.
But now with these techniques with FISH and MP, we can increase the sensitivity of detecting malignancy.
Yeah.
So this brush you can see here, there are two types of brush. The stiff brush are gray in color. They are very stiff. And then there is a gap. And then there is a soft bristles. So the soft bristles will collect the cell, and also the gap allows that bristles to accumulate, or the cells to accumulate over there. So now what we will do is we have taken a good sample which our pathologists are examining. We'll try to...
I think they can show this here. If the samples Dr. Anuradha is taken and making both a smear and a smash, both together. We're making two, and she's going to now examine it with a quick staining and let us know in next 3.5 minutes what exactly is the pathology. Okay. So the plan now is that because it's showing malignant tissue, Mohan is planning to put in 2 stents bilaterally, right and left, so that you can see in this case you can drain more than 70% by this technique. So let's have the cytology shown before we proceed. Yeah, you can see the picture now that Anuradha is there. You can see, Asma, can you see the cytology picture?
Now, yeah, now it's clear.
Yeah. The clumps, you can see the clumps of cells there right at around below 12 o'clock position, very nicely seen. There, I think that's a classical clump of malignant. You can see that now. Can you see, Asma?
Yeah, I can see.
Yeah.
I'm just wondering, any special stain like pathologists can use for such a quick result?
We'll ask Anuradha to join us for a second here, and she'll be able to tell us.
Yeah. So these are the brush from the cytology which Dr. Mohan has just given us. As you can see that there is adequate cellularity and there is loss of normal polarity of the cells. And in fact, we can also observe that there are some discohesive cells. If you just go to the higher part, you can see the nuclear atypia. The cells are enlarged, and there is a high NC ratio and marked pleomorphism with focal acinar structures. So all these high cytology, high cytological atypia and the increased NC ratio overlapping and single cells favor a neoplastic lesion. So the brush cytology is positive for malignancy, and morphology favors adenocarcinoma, probable cholangiocarcinoma.